Welcome back inside the Now Morning Show. We've been talking health this morning, and we continue that conversation this morning with the SDA Health Fair coming up on Sunday, 25th February at the University of the Southern Caribbean. This morning, I have with me Dr. Diamond Gill, medical practitioner at the NWRHA, as well as Dr. Javon Rush, who's a medical practitioner of the Urology Department.
Yeah, urology.
Of the Arima General Hospital, and you're also affiliated with the SDA Community Hospital as well.
Yeah, the Community Hospital of the Seventh-day Adventist, correct.
Fantastic. Good morning and welcome to the show.
Good morning, man. Good
How are you all
morning.
doing this morning?
Excellent.
Yeah, very good.
Yeah? All right, so tell me a little bit about the SDA Health Fair coming up this Sunday.
Okay, I guess I'll start. So good morning, Trinidad and Tobago. Well, as you mentioned, on Sunday, the 25th of February, we're going to be hosting, well, as a matter of fact, we're not going to be hosting, but the Member of Parliament, Dr. Nyan Gatsby Dolly, as well as Mr. Edmund Ford, that is both for St. Anne's East and Tunapuna, would be hosting a health fair in the Maracas Valley St. Joseph district, as well as the Seventh-day Adventist churches within that district. So that would include the Akono SDA Church, La Wengo SDA Church, La Baja, La Mango, La Saiva, and La Mango SDA churches. So this is going to be happening from 9 a.m. on Sunday morning to 2 p.m.
9 a.m. to 2 p.m.
9 a.m. to 2 p.m., yeah.
Dr. Rush, tell me why this is necessary.
So definitely we've seen a need for health fairs such as these because we want to have a dynamic interaction with the community at a consistent pace, because what we've realized that a lot of people are being affected by lifestyle diseases. So we're seeing an uptick in things like high blood pressure, blood sugar, cholesterol, and we're also seeing these diagnoses being made at a younger age in Trinidad and Tobago. So that definitely raised a concern, and what we're doing with the health fair is already offering the public a platform where they can come in and have interactions on a basic level. So we're going to be offering basic testing like blood pressure, blood sugar, and blood cholesterol, but we're also going to be going more in depth in terms of the services that we're offering. We're really taking a head-to-toe approach, and when I say head-to-toe, what I mean is that we're doing things like stroke risk assessment, we're doing eye testing, we're doing hearing testing, lung function testing as well. The ladies will have the opportunity to come in and have their breast examinations. The males will have their prostate examinations as well. Ladies will also be able to have their pap smears as well as their HPV vaccines, right?
No, you just now hold on, because whoo, yeah, boy.
Yeah.
All right, so you have all this happening on Sunday, 9 a.m. to 2 p.m. How long one of these things is take? Because if you're doing a full head-to-toe on somebody, on an individual, how long that going to take?
So I would average a transit time through the whole process of between 60 to 90 minutes, and that is if the person goes through each station, right?
Okay.
But each individual is different, so you're not going to really have one person going to every and each station.
Okay.
Of course, we're going to have those health enthusiasts that want to do so, and we definitely encourage that, right? Yeah.
All right, very, very interesting. So we heard about some of the services that are being provided. Tell me some of the people who are providing these services.
All right, so a number of persons are going to be there sponsoring. So, of course, we have the Community Hospital, Seventh-day Adventist, North Central Regional Health Authority, Queen's Park Counseling Center, Dalton Brown Optometrist, Wright Optical Trinidad and Tobago Cancer Society, Caribbean Vascular and Vein Clinic, Sweet Dental Clinic, JS Dental Solutions, TACAMS Training, Caribbean Health Foods, Chest and Heart Associations, and so much more.
As I was saying, all right, now I understand how it's happening. Now it's making sense, because we have a wide range of suppliers and providing these services. How much does it cost to attend this health fair?
So it's absolutely free, and it's as mentioned before by Dr. Gill, because it's a wide array of different companies coming together, especially the Community Hospital of Seventh-day Adventist. They've been pivotal in terms of the infrastructure necessary for such a health fair, because as you'd imagine, it's a lot of coordination behind the scenes to ensure that the patients or the public has a good outcome when they come, right? Because we just don't want persons coming and then there isn't sufficient follow-up, right? Because that would deter one away from the system. So I would say that because of the amalgamation of persons coming together to make this a success story, it's definitely a very ambitious drive. It's definitely a lot of hard work going into it, but the yield is yet to come.
It's often worth it. I want to go back a little bit. You mentioned lifestyle diseases, and you mentioned that we were seeing them presenting in people of a younger age bracket. What do you think contributes to that?
So I would say one of the major contributors are the sedentary lifestyle, meaning that we are not as active as we should be as a population.
Talk about that just now with the minister.
Correct, right? And the other compounding factor would really be the types of foods that we are introducing into our systems now. You know, I always bring up this school of thought where, you know, 15 or 20 years ago, our parents and our relatives had a way more holistic diet that was richer in micronutrients and was way less processed, right? So they didn't have the health conditions that we have now. But because of it's like a perfect storm at this point, you know, we have sedentary lifestyle, we have bad foods coming in, and then you have genetic risk playing a role as well, you know. So all of that leads to diagnosis at a younger age, and when you're diagnosed with a lifestyle disease at a younger age, it means you have a longer time being exposed to that disease, and there's a higher risk of complications, right? So it's definitely something we need to identify early and nip in the bud.
Yeah.
Is this health fair open to people who may not be of the Seventh-day Adventist religion?
Of course it is.
Is it open to people who are not from Maracas Valley?
Of course it is.
I have to ask, I have to make sure. So everybody's invited?
Everyone is invited.
All right. Well, what advice would you offer to males in particular who have that fear? You know, you mentioned that you're going to be testing the prostate and everybody is still be concerned about the prostate test. What advice would you offer them?
Yeah. So my advice would be that it's really a difficult conversation, and I understand the surrounding fear. But my rebut or my answer to that would be that prostate cancer is one of the few cancers alongside cervical cancer that if we identify at an early stage, we are able to prevent a lot of complications down the line, right? And we have screening tools or instruments we use to detect these diseases at an early stage. And specifically for men, we have a blood test called a PSA, or prostate-specific antigen. And that's basically a protein that's released from the prostate after a certain age, and the numbers tell us whether to look out for disease or not. So just for the general public and for general information, the number is supposed to be less than 4, right? So if you have a number that's greater than 4, it indicates one of 3 things. You may be having an enlarging prostate, you may be having an infection of the prostate, or the last and the most feared, which is cancer of the prostate, right? So a lot of the fear and the phobia around prostate cancer is that you need to come in and have the finger examination. And yes, there's a role for the digital examination, but that isn't the first step. The first step is really, you come in as a man, we have a face-to-face conversation, we determine your risk based on your age, based on your lifestyle, based on your genetic history as well. And then we determine what is the next most appropriate step. And you would find in 95% of the cases, it just starts with a simple blood test, right? And then, so the other person in the conversation will say, well, doc, the blood test came back. Let's say in this situation it's abnormal. Do I need to have the finger examination? Well, the answer to that is not really, because again, we're in 2024, we have technology on our side, right? We have MRIs that are capable of determining and finding cancers that the human fingers wouldn't ever find, right? So definitely, I would like to say, to mitigate some of the fears, it's a gentle process. You know, I know the history behind the process has been a bit rough for men, but we have a tool that could spare you a lot of complications down the line.
One of the things I always get very concerned about when it comes to MRIs in particular, you mentioned MRIs, is the cost of them. Because I know they're not cheap.
Right.
So in terms of this, are you going to offer MRIs at the health fair too? Or,
we're not directly offering
just
MRIs. But what I would say to that is, because North Central Regional Health Authority is a provider, right? And we are going to have North Central Regional Health Authority urologists and urology team members there. For the patients that it is necessary, we will be able to offer them a pathway towards having a multi-parametric MRI in the public system.
Okay.
Yeah.
You know, I want to ask how long that does take. What's the waiting list looking like for that?
I would say the turnover time, at least in the hospital that I operate, is fairly small. I would say less than 4 weeks.
Less than 4 weeks?
Yeah.
Well, that's very, very interesting. All right, anything else you want to leave with us before we go this morning?
Yeah, well, Dr. Rush mentioned about the PSA for the men.
All right.
I just want to let the ladies know we also have something for you, your pap smear test. You know, so come on out. It's not as intimidating as the PSA, all right? It's just a simple swab. And we send that to the lab. We encourage women over 21 years old, you know, to come and get your pap smear done. We usually advise that you do it every 3 years once your results are normal. And I just want the residents of Maracas St. Joseph, invite your friends, invite your family, come out and have a good time, come out and know your numbers, come out and know your health status, be aware of your health so that we can be a healthier people in TNT.
And it's happening this Sunday, ladies and gentlemen, the SDA Health Fair from 9 a.m. It's happening at the university itself,
Yes.
at the University of the Southern Caribbean. So you can check it out. Thank you so much, Dr. Gill. Thank you so much, Dr. Rush, for joining us this morning.
My pleasure.
And all the best on Sunday.
Thank you.
I appreciate it.
Ladies and gentlemen, we'll take a quick break. And when we come back, we're going to tell you how you can move a little bit more. We're talking sport when we come back. Stay tuned.